3 experiments. That is all it would take. 3 carefully designed studies, and everything we think we understand about how psychedelics heal the mind could collapse. For months, the evidence has been converging. 10 completely separate fields: neuroscience, psychiatry, pharmacology, clinical trials, trauma therapy, all arriving at the same door, the same mechanism. A model so consistent it feels almost too clean. They call it constraint relaxation. The idea that psychedelics work by temporarily loosening the rigid patterns that trap a depressed or traumatized brain. The walls come down, new connections form, the mind reorganizes. 71% of the evidence points here, 10 out of 10 domains. The model is robust, but robust is not the same as true. The strongest signal comes from an unexpected bridge: late-stage clinical trials on anti-anxiety compounds and veteran trauma treatment programs that seem to have nothing in common. Same pattern, same mechanism. 92% confidence. Psilocybin triggers measurable neuroplasticity, new synaptic connections forming within hours, and patients who received it showed something that placebo could not explain. Their brains were physically different weeks later. The model holds. The convergence deepens. And then there is this. LSD, the grandfather of these compounds, shows a different signature. Where psilocybin and MDMA reduce suicidal thinking, LSD associates with increased odds of suicidality. Same class of substances, opposite outcome. 92% confidence in the contradiction. This is not a minor footnote. This is a tear in the fabric of the model. Because if constraint relaxation is the universal mechanism, if loosening neural rigidity is what heals, then why would one compound heal and another harm through the same doorway? The falsification tests are precise. First, block the serotonin 2A receptor with a targeted antagonist while allowing the subjective experience to continue. If the therapeutic effect disappears but the trip remains, the receptor is not the cause. It is a bystander. Second, induce the same brain state through non-drug means: meditation, transcranial stimulation, sensory deprivation. If healing follows without the molecule, the chemistry was never the point. Third, measure neuroplasticity in patients who improve versus those who do not. If the brain changes equally in both groups, the new connections are not what is doing the work. Any one of these could shatter the leading model. All 3 could rewrite everything. This is not abstract. Right now, regulatory agencies are deciding whether these compounds become medicine. Veterans with treatment-resistant PTSD are waiting. Patients who have failed every other option are watching. The bridge between clinical trials and implementation is real. The evidence flows directly from the laboratory to the treatment room. But if the model is wrong, we are building that bridge on sand. And no one has run the experiments that would prove it. 3 experiments. That is all it would take. And the question no one is asking is why they have not been done.